Today on our special series, Nips, Tucks, and Teens, Teenagers and Plastic Surgery, what doctors will and won't do. Botox is not just for the over 40 set anymore, apparently. A rising number of teens across the country are having cosmetic surgery procedures, including Botox injections, cheek implants, and liposuction. This morning, we hear from some doctors who perform these procedures on teens. Plastic surgeons around the nation have seen firsthand the recent rise in teenage plastic surgery, as well as the possible reasons why.
Well, I think the increase in visibility on television, the access to the internet, a lot of other areas of the media, all the videos that teenagers have access to now, provides a new knowledge base that allows them to find out about things that they never knew about before. And in one sense, it creates a lot more education for a person. It gives them more information to base a good logical decision upon. In another sense, it gives them more information to chase something that they shouldn't be after.
I think that the standards of beauty have really changed from, let's say, the 50s until now. Miss America in the 50s was 5'7" and weighed 150 pounds, whereas last year it was 5'9", weighed 117 pounds. All this tends to influence the child who is growing up and who all of a sudden is faced with the reality that appearance does matter in our society. I think that being a teenage girl is almost like being a walking Miss America contest almost every day.
And what they found is that teenagers are usually looking for very adult procedures.
For instance, you know, we've seen some actresses with really big lips, and on them they look very pretty. But on a particular individual that comes in, bigger lips might look a little funny. So part of my job is not just to do the surgery or do the treatment, it's to tell them they don't need it. Sometimes they don't want to hear it.
But as with adults, surgeons won't do any procedure without first meeting strict criteria.
The main thing is that, first of all, that the patient themselves initiates the request. In other words, that the parent isn't the one that's wanting his or her child to have cosmetic surgery.
Whatever it is they're concerned about, when you look at them, is there really a problem, or is their perception of themselves not realistic?
Obviously, if there isn't a problem, then there isn't anything to do.
Surgeons can only do so much, and there's a line we can't go across. There are things that we cannot accomplish, so we need to make sure they're realistic in regards to what we can accomplish surgically.
And the final thing is that they be psychologically stable and fit, that there isn't any problem with eating disorders, there isn't any problem with bulimia, with overly anxious, depressed individuals, because obviously not only would they have a difficult time with the cosmetic surgery, but it probably won't affect what they want it to affect, and it may actually make it worse in their life.
Do they have the ability to accept the change that they're wanting? Will they be happy with the change 10 years from now? Because this is not like changing your hairstyle.
But often these young patients are looking for something other than what a plastic surgeon can give them.
Their feelings that everything depends upon their appearance is true in most cases. Unfortunately, our society definitely places too much emphasis on appearance, but it's neither for me to say or change.
If a patient comes in and they're trying to be somebody else, that's a real key to say that they're unrealistic. And those are the type of patients that are going to be happy, because they're never going to be a Britney Spears. They're never going to be some of these other stars that are out there. I want to avoid the patient that's got this image of some movie star in their head that they're trying to emulate. That's the kind of patient we don't want to operate on. They don't need me. They need something else.